Hello, my name is Samantha Duffel, and I'll be giving a brief lecture today on the care of a patient with carotid stenosis. First, a little bit of an outline of what is going to be covered today. We're going to go over the pathophysiology behind carotid stenosis, presenting signs and symptoms, risk factors, an explanation of the procedures used to correct carotid stenosis, assessment that you, the nurse, will do, and common complications and interventions to combat those complications, as well as documentation. Here is a list of the learning outcomes that students and learners will be expected to achieve following this lecture. You can pause the video and read these. So first, we'll begin with what is coronary artery disease. Coronary artery disease occurs when plaque is built up along the external or internal carotid artery, leaving an individual at an increased risk for stroke. With this plaque buildup, as you can see here in the corner of the PowerPoint, individuals may experience symptoms such as a TEA or TIA, a transischemic attack, or a stroke, anything that's a sign or symptom of an ischemic symptom. You can look down below, so remember your Be FAST acronym. And these patients also present with a carotid bruit sometimes. Things that place individuals at risk for developing carotid stenosis include high blood pressure. With high blood pressure, this puts an excess pressure on the vessel wall and predisposes them for damage. Tobacco use, the nicotine and tobacco products can irritate the inner lining of the arteries. Diabetes. When one has diabetes, they have a decreased ability to process fat, and this places them at greater risk for developing other diseases like hypertension and arterial sclerosis. High cholesterol or hyperlipidemia. This promotes the accumulation of those plaque buildups. A family history and age. The older you are more likely to suffer from a stroke. Obesity. Having an increased weight also increases one's chance of having hypertension, arterial sclerosis, or diabetes. Sleep apnea. The periods where an individual stops breathing while asleep may increase their risk of a stroke. And lack of exercise. This contributes to conditions that damage blood cells or blood vessels, excuse me. So, how does one come to the diagnosis? Typically, diagnosis is confirmed via ultrasound or other imaging tools to determine the degree of stenosis. Typically, only patients that are symptomatic with moderate to severe stenosis receive either a TCAR or a CEA procedure. Occasionally, patients that are asymptomatic that have severe stenosis will also receive a revascularization procedure to help remove or to stent the plaque area. So, a little bit of an explanation on the carotid endarterectomy procedure. Here is a diagram to help explain. As you can see in this patient, you have a plaque going into the common carotid artery, into the internal, and a little bit into the external artery. Physicians will sedate the patient, create a small incision along the neckline here, and remove the plaque. And then they will suture the artery and they will close the patient's neck up. During this time, blood flow is kind of diverted using a tube system to bypass the plaque area so that way an individual does not lose circulation during this time. Here is a video that you can see that also shows the procedure a little bit better if you're more of a visual learner. For the TCAR procedure, it's a bit more extensive, and there is a video that shows us that I will be playing for you guys.
The TCAR procedure begins with a small incision just above the collarbone to expose the carotid artery. A vessel loop is placed to control the artery during the procedure, and a suture is placed for easy closure of the puncture site at the end of the case. A specialized sheath is placed through a small puncture in the common carotid artery. This sheath will be used to deliver a stent, but first it will temporarily reverse blood flow in the artery. Flow reversal keeps debris moving away from the brain, protecting it from dangerous emboli. The sheath is connected to a circuit outside the body that directs the blood flow into the femoral vein. The connection between the high pressure arterial system in the brain and the low pressure vein in the leg creates a pressure gradient, causing blood to move backwards in the carotid artery. Clinical studies have shown this temporary redirection of blood flow is not problematic because the brain is fed by multiple arteries, which maintain cerebral blood flow throughout the procedure. The en route transcarotid neuroprotection system provides operator control over the blood flow rate throughout the procedure. With flow reversal established, predilation of the lesion is performed, sizing the balloon 1:1 with the diameter of the internal carotid artery. The conformable en route transcarotid stent is then placed to stabilize the plaque against the wall of the artery and minimize the potential for a future stroke. Balloon catheters can also be used to further expand the stent when appropriate. The delivery of these therapeutic devices can disrupt the plaque, causing dangerous debris to come loose. The en route transcarotid neuroprotection system is designed to capture and filter that debris throughout the procedure to prevent a procedural stroke. Once the stent is placed, the clamp is loosened and the sheath can be removed so that blood resumes its normal path to the brain. The vessel is closed using the sutures placed earlier.
Following the TCAR or carotid endarterectomy procedure, patients come back to our unit and we are required to assess and document to our assessment. Per our hospital guidelines, we are required to do vital signs Q15 times 4, Q30 times 2, Q hour times 4, and then Q2 hour times 6. During this time, we do a complete neuro assessment that follows the same frequency detailed above. We assess the access sites, whether it's just the neck incision or it's both the neck and the leg site. You will also do a neurovascular assessment on the accessed leg if a TCAR was performed. So, typical complications and interventions to assist in these complications. One less common complication now is a stroke. It occurs in about 3 to 4% of these patients that undergo carotid stenosis repair. This is why we do a complete neuro assessment when patients arrive to the floor so we know their baseline. In the instance of a stroke, you are to complete a complete neuro assessment to make sure that you're noting all deficits at that moment and document the time you notice them. You may call a rapid response so that way the rapid response nurse can see the patient and potentially run a stroke response, and then you will notify the MD that performed the surgery. Additional complications include hematoma, bleeding, pseudoaneurysms, and this occurs in about 3.8% of patients. This is more common in the TCAR compared to the endarterectomy. In this case, you would apply pressure to the site that's bleeding. If bleeding continues after pressure has been held, then you would notify the doctor for further instructions. When teaching these patients upon discharge what to do to prevent this from happening again or to decrease their risk moving forward, teach them about maintaining a healthy lifestyle, including healthy weight, healthy diets like a low salt, lots of fruits and veggies, low cholesterol, exercising regularly, limiting the amount of alcohol one consumes, as well as smoking cessation, and then controlling these chronic diseases such as diabetes and hypertension, hyperlipidemia. I've attached here a little worksheet that you can give your patients to help them better understand carotid stenosis. And now we will be working on a case study. So if you want to pause this, you can read it. I'm also going to read it out loud right now. A 66-year-old man with a past medical history significant for hypertension and coronary artery disease with stable angina presents to the clinic with a recent history of transient unilateral weakness. The patient states that 1 week ago he experienced weakness in his right hand at work that resulted in temporary inability to write or hold a pen. These symptoms persisted for about 50 minutes and resolved without further reoccurrence. He has a history of hypertension, angina, and a 45 pack year history of smoking. His past surgical history, family history, and social history are unremarkable. He takes 81 milligrams of aspirin, 21 milligrams of lisinopril, and nitrates as needed for angina. On examination, his temperature is 98.1, pulse 68, blood pressure 132 over 86, and respiration says 12 breaths per minute. He is awake, cooperative, and is in no acute distress. Bruits can be heard over both carotid arteries. The result from the cardiopulmonary examination and the remainder of the physical examination are unremarkable. So I want you guys to take a minute and pause the video and think about what the next steps would be hearing this patient come into a clinic and what their diagnosis most likely is. So go ahead and pause and have an idea in your head. Okay. So next steps would be an ultrasound to confirm a diagnosis. And the most likely diagnosis here is the carotid stenosis and TIA. As you can recall from the case study, the patient experienced a transient episode of unilateral weakness where he couldn't hold his pen. And he also has the bruits that you could listen to over his carotids. And as I mentioned earlier, an ultrasound is the best way to confirm this. So let's go back to our case study. And this time I want you guys to think about specific risk factors for this patient, as well as the clinical presentation. I already gave a little bit of this away in the previous slide. So go ahead and pause the video and think about what the risk factors would be and the clinical presentation for this patient. All right. So our risk factors for him might be hypertension, diabetes, a smoke history, and then increased blood cholesterol and fat. And as far as the clinical presentation, I had mentioned it earlier, the bruits over the carotids, as well as the TIA symptoms, the unilateral weakness, and so on. The next slide is just the link to the multiple choice test for you guys to complete on this lesson, and the link to the written assignment. Here is my references, and thank you for listening and taking the time to get educated on carotid stenosis. And there's my email if you guys have any questions. Thank you.